Hello and welcome everyone to the very first National Pharma School Network Resource Roundup. We are going to give it a couple minutes for folks to continue to hop on and then we will get started. Welcome to everyone just joining. This is the very first National Pharma School Network Resource Roundup webinar in a new webinar series that we have just launched in 2019. Before we get started with today's content, I want to go through a few housekeeping reminders. This webinar will be recorded and archived for future viewing in the National Pharma School Network Resource Database. You will also, as an attendee, receive a link to access the recording and a follow-up email, as well as links to resources that are being shared on today's webinar. All of the attendees are in listen-only mode. If you do have questions, please feel free to enter those in the question box on your control panel, and we'll have plenty of time at the end for Q&A to go through those questions that you submit. As I mentioned a moment ago, these new webinars through the Resource Roundup webinar series will be held throughout 2019 on a quarterly basis. The next one is going to be coming up on Wednesday, May 29th at 3 p.m. Eastern, so go ahead and mark your calendars for that. And with that, let's go ahead and jump in. On the next slide, I want to start for those of you who may be new to the National Pharma School Network with an explanation of who we are and what we do. So NFSN, the National Pharma School Network, is an information advocacy and networking hub working to connect communities to local food sourcing, school gardens, and food and agriculture education in schools and early care settings. So as you can see on the slide, we are truly, as our name implies, a national network. We have more than 20,000 network members. We have more than 200 core and supporting partner organizations. So these are folks that are at other agencies and organizations at the state level. We have an advisory board, and then we have national staff, a couple of whom you'll be hearing from today. I invite you to learn more about our network and find partners, those core and supporting partners in your states, DC, and US territories from our network page at pharmaschool.org. And on the next slide, I'm just going to show you all, before we dig into the specifics of today's content, a little bit more about other upcoming webinars. So we do these Resource Roundup webinars on a quarterly basis, and then we also have a monthly Trending Topics webinar series. Our March webinar coming up on the 7th of March is going to be featuring our 2019 National Partner of the Year. So this is, as a national organization, a partnership that we established in 2017 to select another national organization every year to team up with. So for 2019, that's the Intertribal Agriculture Council, to focus on our farm to school work with Native communities. So we encourage you to join that. And then Chloe Marshall, who you'll hear from shortly, will be leading a series of listening sessions for the new Child Nutrition Act reauthorization that Congress may take up later this year or early in 2020. So this will be an opportunity for you to learn more about federal policy and how to get involved. There'll be 4 listening sessions to give input. It'll be the same content each time, so just plan to join one of those to share your ideas. And as a reminder, participating in those and sharing ideas is not lobbying. So with that, now that we've given you a sneak peek of things to come, I'm going to jump us into today's webinar agenda. We are featuring in this first Resource Roundup 3 specific new resources created by NFSN. In general, these resource roundups will not always just focus on NFSN resources. We will also feature resources that have come out from all of our core and supporting partners. Today, we're going to feature 3 resources that we've recently put together, and they all have a policy component to them. Policy is one of NFSN's 3 core functions, as I mentioned a couple of minutes ago, along with networking and information services. And it's important to know that policy doesn't just mean passing legislation or working on bills. It's all the work that happens once bills get put in place, and it's what people sometimes refer to as little p policy, or the things that happen in organizations. So in organizations' practices, things that are happening at a school district or even at your home. So the policies that are around your household. So today's webinar is going to be featuring the Programs and Policy Racial and Social Equity Assessment Tool, Supporting Pharma School with Nonprofit Hospital Community Benefit Dollars, and then City and School District Pharma School Policy Opportunities. On this next slide, you'll see the faces of those that you'll be hearing from today. My name is Helen Dombalis. I'm our Senior Director of Programs and Policy based in Colorado. And then Chloe Marshall is our Policy Specialist based in Washington, D.C. So going then to our first resource, and I'll be passing it to Chloe for this, equity has been central to the National Farm to School Network since our founding. It's one of our core values, and you can see the list of core values on the last page of the equity assessment tool. There's been a recognition amongst NFSN partners, advisors, and staff of the need to really put equity into action. So rather than talking about how advancement of equity is a value, it's important to actually put it into action through the work that we do programmatically and through our advocacy efforts. So with all of that being said, last year we reviewed a lot of other organizations' resources to help us further this work of actually putting equity into action. We want to be really intentional about the fact that it's important to focus at NFSN both on racial and also on social equity. As you all are aware, there are many inequities in the food system and in our society, and so it's important to address both racial and social inequities through the work that we do in Farm to School. And ultimately, the idea is really to maximize, with this tool, our impact and the work of you all as our partners on advancing equity. So when we're building a new program or we're working on a new advocacy initiative, we have to carefully consider everything that we should have to ensure that we're really maximizing that impact on advancement of equity. So with that, I'm now going to pass it to Chloe, our policy specialist, to dig into the details of this resource.
All right, hi everybody. My name is Chloe Marshall. Like Helen said, I'm the policy specialist at National Farm to School Network, and so I'm going to be talking to you today about our programs and policy, racial and social equity assessment tool. So if you feel like being able to access that, just right now, you can go to farmtoschool.org/equity, and there towards the bottom of the page, you'll actually find that resource linked under resources. So it's okay if you're not looking at it now. I'm just going to kind of talk through it. Through the table of contents, there's 3 key pieces in this assessment. The first is the setting outcomes of staff and key stakeholders. The second piece is food system questions. And that third piece is going to be about equity programs and policy analysis. So like Helen was saying, this tool is really a way for us at NFSN and a way for our partners and for anyone else interested in farm to school and what equity looks like in the food system as a whole. It's a way to put equity into action, taking those words and ideas and definitions and making them actionables that can actually move us towards more equitable ways that we do things. So the tool is meant to complement the work that you're already doing. It's to really refine that and make it push it towards the place of equity intentionally. So you're not doing it by accident, but doing it really purposefully in the work that you do. So whether you're looking at it or not, like I said, it's divided into 3 parts. That first section is about setting outcomes with your staff and key stakeholders. So under that are 2 subsections that we have, big picture questions about stakeholder equity engagement, and then big picture questions about staff and network priorities. Again, these are big picture, so you're not, not drilling down too much, but really about getting the discussion started. And the purpose of this is really to ensure that the conversations are happening within your organization, and what are the goals, and setting those goals and outcomes for what equity is going to look like in the work that you're doing. They ensure that the big picture questions about equity engagement among your stakeholders, they're meant to help you ensure that racially and socially disadvantaged populations are active in creating equitable programs and policy solutions that are carried out by your organization. And if you're looking at this document online or have it in front of you in any way, it says by NFSN, you can replace that with your organization's name to make that fit for you. But those questions are meant to ask, are we involving the people that we're supposed to be serving in the policies and programs that we're creating? So you'll see some questions that really get at how do we engage these folks? How do we bring them to the table and make sure that their voices are heard in what we're doing? What are other organizations doing in this space, and how can we support that? The next set of questions is about staff and network priorities. And again, starting to dig more at, how are we engaging the people that are going to be most impacted by these policies or these programs, and making sure that their voices are heard, and making sure even that the policies and programs you're looking to put in place or you're exploring have anything to do with racial and social equity, and that's built into how they're created and crafted. The next section would be food systems questions. Excuse me. And that really focuses on helping you to talk about what is or isn't equitable about the policy or program that you're looking to put in place. So this has a lot of questions, and this is something that we're always open to feedback on. So if you have anything to share about it, or if you have any questions about it, we are absolutely open to you giving your feedback on this tool, because it is a living and dynamic document. But again, these food system specific questions help you talk about what equity actually looks like and how to actualize that when it comes to food system work, in particular relating to yours. So and the goal is these are all yes or no questions. And then there's a space to talk about how or why you're doing this thing. So the goal is to get a yes on every question. And you may not be there when you first take this assessment, but the nice thing is that equity happens on a spectrum. So you're not inequitable one day and then completely inequitable the next, but as you're moving along that spectrum, you want to answer more yeses as time goes by. And doing that again intentionally, and really thinking about the ways to make that happen in your organization. So the last section would be an analysis of equity within your programs and policies. So these questions are going to be helping you think critically about the intentions, the impact, and the long-term equity outcomes of the specific program or policy proposal that you're putting forth. So there's about 3 different parts to this. One is determining the benefits and or the burdens of a program or policy. And that's really about, for specifically with your organization's goals, how do these line up, and how do these really fit into the mission, and what problem does this program address, and is it about equity, and does it impact certain populations more than others? The next section is going to be identifying policy holes. And those holes can be, are there unintended consequences to this policy or program? Does it disproportionately impact one group, or does it do active damage to another? Is it neutral in that place? And other questions like that. So that last section then is going to be examining sustainability and accountability. So looking at the program or the policy, how it's designed, is it built to last, basically? And who's going to help carry that out? How is success being measured in the short term, the long term, and looking at how the goals are set and assessed later on. So that's the tool in a nutshell, and I'm happy to answer questions about that at the end. But just a couple of things here that we have just to get started with this kind of tool, using it in your own organization and your own work. First steps is just review it, take a look at it, and just get a general sense of what's happening within that tool and how that's going to relate to your work and your organization. And then do a practice round with your organization. You may find that some things do apply or don't apply, or there may be some things that you're not quite understanding, or you may just be starting a conversation, like I said earlier, it's just walking people through what even the idea of equity looks like for you all. So those are just a couple of initial steps, and I hope this is helpful for you. I'm going to pass it back to you, Helen.
Great, thanks, Chloe. And before we go to the next resource, I appreciated what you just said about doing a practice round. I will share with you all that the National Pharma School Network staff have done a couple of practice rounds with this equity assessment tool. 2 examples quickly to share with you. One is that we are gearing up for site selection for our 2020 National Pharma Cafeteria Conference. And so we went through the tool with that consideration of where to host an event in mind. And it was really eye-opening in terms of informing the community engagement in that site selection process and the types of pharma school sites that we would want to feature on field trips. So that's one example. And then another one is that we are starting, as I mentioned earlier, to gear up for the Child Nutrition Act reauthorization and looking at different federal policies that could incentivize more local procurement. And when we went through the equity assessment tool with that policy idea in mind, we realized that we really need to consider being more clear in our policy ask, not just about additional money for local procurement, but local procurement from, for example, socially disadvantaged farmers and ranchers, as the government calls it, or farmers of color. So realizing that it's really important in doing a practice round like that to consider when we're working on an advocacy effort or a programmatic effort or even site selection for a conference. It's really important to use this tool to really bring to the forefront things that you might otherwise not have considered. So those are just a couple of examples. And again, Chloe, thanks for walking through that first resource. So I'm going to go now for our second resource that we're featuring on today's webinar. And this is a resource called Supporting Farm to School with Nonprofit Hospital Community Benefits Dollars. So again, this is another policy example, but it's once a law is being implemented. So this is a chance now for you all as farm to school stakeholders to get engaged and learning about policy that's being implemented and how you can use it to support your farm to school efforts. So you'll learn more as you read through this resource that over half of U.S. hospitals are considered nonprofit organizations, and so there's federal tax code requiring those nonprofit hospitals to provide community benefits in order to qualify for tax exemption. So those community benefit allocations total an estimated about $24 billion available on an annual basis to provide financial assistance to patients and other health improvement activities. And one of those types of health improvement activities can be an investment in farm to school. So not to say that all $24 billion are available for farm to school, but a portion of that. So for example, in 2015, nonprofit hospitals spent about 13% of their total hospital expenses on community benefits. About 0.3% went to cash and in-kind contributions directly to community groups. So most of the community benefits, in other words, are going to direct patient care, but the Affordable Care Act, specifically Section 9007, requires these tax-exempt hospitals to conduct a community health needs assessment and implementing a strategy based on the health needs assessment every 3 years to work with public health agencies and community partners to assess community health needs, plan how to address those needs, and then provide community benefits. So that Affordable Care Act has that new focus on addressing the social and environmental determinants of health, and that really places programs that work on healthy food access, farm to school, in a unique position to work with hospitals to promote community-wide health initiatives. So in other words, there's really significant opportunity for farm to school stakeholders like you all to partner up with your nonprofit hospitals to provide resources to support farm to school and ultimately foster public health. So in other words, the Affordable Care Act really has this provision in place saying that these nonprofit hospitals need to conduct these community health needs assessments and then implement, as they address the needs identified in those assessments, community benefits for community health. And one of those, as we all know, can be farm to school. When we talk about the benefits of farm to school, as you all are intimately familiar, one of the many benefits of farm to school is advancing public health. So on the next slide, now that I've given that introduction to why we made this resource, I want to talk to you a little bit about what the resource includes. So the table of contents for the resource include a background. So that's a lot of what I just covered. What's the history? What's behind community benefit dollars? What does that even mean? You know, how I know if it's a nonprofit hospital. And then we go through tips on how you all can get involved and case studies. So this is where we dug into some specific examples of where nonprofit hospitals around the country have already provided community benefit dollars to support farm to school activities, such as building gardens in schools. And then lastly, in the resource are additional resources. And one of those in particular that I want to give special thanks to is a partner organization of ours called Healthcare Without Harm. Healthcare Without Harm developed a community benefit resource called the Delivering Community Benefit Healthy Food Playbook. And so that specifically goes through a lot of details not just specific to Farm to School, but more broadly, how to leverage community benefit dollars to support food systems work. And so that resource is linked in there for you all to check out as well. And again, there are lots of case study examples for you all to dig into. As far as first steps, if you're not familiar with this resource, certainly just as Chloe said with the first resource we talked about, take time to review it, just get familiar with the content is. And then secondly is identify nonprofit hospitals in your area. So you may know about the hospitals that are around you, but the next step is to figure out which ones of those are under federal tax code nonprofits and thus are working to allocate some of their community benefit dollars. And then what you can do, and this is all outlined in further detail in the resource, is specifically find out about the community health needs assessments that they may have done already. So going through and seeing what's been identified in the community health needs assessments related to food or related to school food, for example, may then help you as an entry point into approaching these nonprofit hospitals in your area to talk to them about supporting farm to school efforts. I'm not going to go through all of the details, but in the resource, it does really outline for you all how to find out about what is in those needs assessments, who to reach out to at the hospitals, and really how to introduce a conversation about how farm to school is a proven strategy to advance health. Before we go to our third and final resource for today's webinar, I just want to point out to you all that in the chat box on your control panel, Lacey, our program manager, has been sending out, thank you, Lacey, the links for the first two resources. So the one that Chloe discussed and then the one that I just covered. So if you all want to be actively looking at these as we're talking about them, click on those links. So going now to our third and final resource that we're going to feature today, this is a resource called City and School District Farm to School Policy Opportunities. So I referenced earlier, there are many types of federal policies that can support farm to school. For example, the upcoming Child Nutrition Act reauthorization. Some of you might be familiar with the Farm Bill that passed at the end of last year. There are also policies at the state level. National Farm to School Network works on a resource every other year to feature state farm to school policy examples, and we have a new version of that coming out later this spring, and we'll do a webinar about that. But this resource is specifically looking at municipal level policy and then school district level policy, digging in very specifically with school districts to something called local school wellness policies, and with cities to something called good food purchasing policies. So on the next slide, I want to dig into some of the details of what these mean and what's featured in this resource for you all to take a look at. And again, I just want to make the point, as I've made earlier in this webinar, that farm to school policy just isn't about passing bills. It's all the types of things that don't involve legislation, such as the things that we are going to be talking about now. So as far as local school wellness policies go, any school district that receives federal funding for implementing school meal or other child nutrition programs through USDA must have a wellness policy in place. So as part of the WIC Reauthorization Act, it was the Child Nutrition Bill back in 2004, local education agencies that participated in the National School Lunch Program or these other child nutrition programs were required to author a school wellness policy by school year 2006. And then the most recent version of the Child Nutrition Act reauthorization, called the Healthy Hunger-Free Kids Act, in 2010 modified those requirements, specifying implementation, evaluation, and reporting requirements. So basically they added some teeth. There was a recognition that there was a requirement for school districts to have these wellness policies, but it didn't really mean much. There wasn't any ground rules around actually putting those policies into practice. And so the 2010 Child Nutrition Act reauthorization really added some teeth to that. So a final rule about the local school wellness policies came out in 2016 and includes minimum requirements that local school wellness policies must include specific goals for nutrition promotion and education, physical activity, and other school-based activities that promote school wellness. And the local education agencies are required to review and consider evidence-based strategies in determining these goals. And so again, I'll pause here just to say, this is another way that we can insert farm to school because it is a proven strategy. You all probably are already familiar with our most popular resource at the National Farm to School Network, personally my favorite resource, and that's the Benefits of Farm to School Fact Sheet. And so that resource has a great literature review of all the research that's been done on farm to school, and that includes public health impacts such as increased consumption of fruits and vegetables. So the idea here is really to go to school districts and talk to them about how farm to school is a proven strategy to increase and advance wellness, and thus can be written into these local school wellness policies. Secondly, I want to talk to you all about good food purchasing policies. And for this one, I want to give a shout out and a thank you to the Center for Good Food Purchasing. So good food purchasing policies are focused on not specifically just farm to school, but around with municipalities purchasing that they are doing. So all types of institutional purchasing. So it can be with K through 12, it could be with early care and education sites, it could be purchasing that the city is doing within its own buildings and cafeterias. But the idea is that these good food purchasing policies, again, are not farm to school specific, but another way at that city level to promote farm to school through local procurement. So the resource, in addition to talking about local school wellness policies for school districts, talks about these good food purchasing policies with examples from LA, Chicago, and the other cities that are starting to pick up on and really move with this idea. And then as I mentioned with the last resource, this resource as well provides other resources and ideas for you, such as learning more about the Center for Good Food Purchasing. So as far as first steps go for you all, we certainly encourage you, if you haven't already, to review the resource. The link is there now in the chat box for you. And then secondly, it would be just to start out by finding out what's already happened. So go to your local school district, find out what their wellness policies look like. Do they have anything included right now around gardening or food and agriculture and education, or even local purchasing? So those core elements of farm to school. And the same thing goes with your cities, going and finding out, and you can use the Center for Good Food Purchasing Policies website to do this, going and finding out whether or not they already have any guidelines for good food purchasing through your municipalities. So with that, that concludes the overview of the 3 new resources that we're excited to release today. I am going to pass it to Lacey Stevens. She is a program manager with NFSN, and she has been taking note of questions as they come in. If you haven't submitted questions yet, a reminder, you can submit those on the chat box, and Lacey will open it up for Q&A with Chloe and myself.
Great. Thank you so much, Helen and Chloe, for that great overview. I'm really excited to be sharing these resources. And as Helen said, as you do have questions, please do go ahead and enter those into the chat box, and we'll get to as many as we can in the time that we have left. To get us started, our first question is about the toolkit from Healthcare Without Harm. Again, that is the Delivering Community Benefits Healthy Food Playbook. Helen, could you speak a little bit more about the interaction between that resource from Healthcare Without Harm and the new National Farm to School Network Farm to School resource?
Yeah, great question. And again, can't say enough to thank the Healthcare Without Harm for the work that they've done in developing that community benefits playbook. So we reviewed the Healthcare Without Harm community benefits playbook and the content of that specific to farm to school and developing this new NFSN resource. So there are examples that come from Healthcare Without Harm's community benefits playbook that got incorporated and of course cited. And then we did some additional research and interviews and investigation with National Farm to School Network core and supporting partners to find other examples that had not been included in that playbook. As I mentioned earlier, the Healthcare Without Harm work is broader than just working, for example, on connecting community benefit dollars to schools per se. Healthcare Without Harm focuses on all the ways that community benefit dollars can support healthier food access and sustainable food systems. So we did pull some ideas and learnings from that, and then added in some unique content from the school partners around the country.
Great, thank you, Helen. Our next question is again about the community benefits. Do you know if Indian Health Service hospitals would be included in this nonprofit status?
I do not, because I don't know. I'm familiar with Indian Health Services. What I don't know is if those are considered nonprofit and, you know, part of the specific tax code for nonprofit status. We will make a note of that. if you, Lacey, do you have contact information for the person that submitted the question? We can certainly find out that information.
I will. I'll be sure to make a note and we can follow up. Great question. Our next question is about resources in general. What resources does the National Farm to School Network have that are available to print?
Great question. Lacey, do you want to jump in or do you want me to start by taking that?
Sure. I'll just let everybody know that all the resources that we've shared today and all of our resources that we've released in the past, including the benefits fact sheet, that is one of our most popular that Helen mentioned earlier, are all available on the Farm to School website, farmtoschool.org, in our resource database. And those are all open for everyone to print, freely available for folks to print offline. Anything to add to that, Helen?
Yeah, thanks, Lacey. I think the only thing I'll add is that, as I mentioned earlier, there's a very extensive resource library. So if you go to farmtoschool.org and click on resources, that then provides you access to thousands of resources, not just those created by the National Farm to School Network, but produced by you all and all of the farm to school stakeholders throughout the country. We do have resources, some of which have now been translated into Spanish. And I'm going to send out via chat. There's one link that we include on our website that's a compilation of NFSN fact sheets and outreach materials that are all, of course, can be printed. So we will share that via the chat box so you all know about those.
Great. Thanks, Helen. And I'll mention that if there are specific resources that you're looking for, please feel free to contact myself or Helen or Chloe, and we can certainly point you in the right direction. Our next question, I think, is really around school level policy. And maybe there are some examples within the school district policy resource and the good food purchasing that you might be able to point to, Helen or Chloe, about working within a school district that works with a contracted food service company. And how does school food policy or potential school wellness policies relate to working with a school district that is under a contract company for their food service?
Great question. So it's certainly going to depend on the details of what that contract is that's in place with the school district. And there's a lot of work that can be done outside of the school wellness policies to, over time incorporate more into those contracts that supports farm to school activities and really farm to school procurement. Specific to the local wellness policies, since that's, the question and one of the featured resources for today, I would start by finding out, if you have a specific school district in mind, finding out what their wellness policy looks like. If there are things incorporated around local procurement, for example, requesting a meeting with the food service director to talk about how that wellness policy angle is being incorporated into the contract. If local procurement is not currently written into the wellness policy, you can certainly work to change that. And there's I didn't mention this, but in the new resource, there are model wellness policy language and templates that we pulled from various examples around the country. So you can work to address the content of the wellness policy, but then what we know is that there are many school districts around the country, wellness policies incorporated or aside, that have now built more local procurement content into and farm to school values really into contracts with food service management companies. So working with a food service management company to say, we want X% local, we would like to store, and, local is defined as, X, Y, or Z. We would like to support more, going back to the equity conversation earlier, purchases from farmers of color. So there are great examples around the country of where that's been done. And I think you're bringing up, whoever is asking this question, a great point that one entree point into that can be using the wellness policy to make the case for updating those contracts.
Great information. Thank you, Ellen. Our next question is around the Programs and Policy Equity resource. And Helen shared examples of how the National Farm to School Network has utilized that resource in some types of programs or policies. Helen or Chloe, could you provide some more examples of what types of programs and policies would be a good fit for utilizing that resource?
I'm sorry, Lacey, you cut out for just a second. Can you say that question again for me?
Sure, excuse me, thank you. Could you provide some more examples of the types of programs or policies that would be a good fit for utilizing that resource?
Yeah, so I think when you're utilizing this resource, I would definitely say this applies to, we've obviously applied it to food, farm to school policies, but just it's good to zoom out and look at any kind of food system policy that you're looking to implement, especially around if you're asking the question of who does this impact when you're looking at your policy. So with farm to school, we're looking at grant programs, who they're targeted to, and if those schools or programs are able to access things like that. So that's just one example of how to apply that. But again, if you're also zooming out and just looking at your organization as a whole and how it carries out its work as well, you can adapt this to really fit what it is you're trying to change and make your work more equitable. So it is pretty, it's pretty useful across the food system. And like I said, some questions, or like I said earlier, some questions won't apply to everything you do, but looking at the tool to see where exactly it applies in your organization or within your work. But again, food system wide would be, I hope that answers the question.
And this is Helen. I can jump in with a few other recent examples of where we've used this tool. So I mentioned earlier site selection for a 2020 conference, which we've yet to announce. Secondly, was that consideration of a federal incentive bill, so incentivizing local procurement with more money, modeled after what some states have done. A third way that we have recently used this is looking at previous policies where we've advocated. So for example, in the 2010 Healthy Hunger-Free Kids Act, we advocated and successfully advocated for the first time ever to get mandatory funding for the USDA Farm to School Grant Program. I'm sure most, if not all of you, are familiar with that program. So written into the legislation was a line specifying to the maximum extent possible that when awarding those grants, USDA prioritized school districts with high percentages free and reduced price lunch. Now, that's looking at equity from an income standpoint. But what we've realized going back and looking at that legislation from 2009, really drafted in 2009, 2010, we realized that there's more that we could have done in specifying how that grant program makes its awards and who is considered for receiving those funds. There's more that we could have done to advance equity. So that's an example of where it's retrospective, but it's also something that we know we're going to continue to work on, advocating for that USDA Farm to School Grant Program, so we can continue to make tweaks for the legislation to better ultimately advance those funds from the federal government supporting the communities that have the highest need for them. Another example I'll mention is that, part of this equity assessment tool is not just the work that the National Farm to School Network is doing, but the work that we are supporting based on our partners' efforts. So for example, there was a recent sign-on letter going around. National Farm to School Network was contacted. We were asked to sign on, encouraging Chef Jose Andres, who has restaurants in DC, to actually consider amending his policies with regards to living wages for his restaurant employees. And so when we initially received that request, the thought was, well, this is outside the scope of farm to school. This has to do with wages at restaurants for employees. Yes, it's important for an equitable food system to have living wages, but how is this related? But then when we actually looked through that equity assessment tool, there are questions in there, not just about what we are doing, but what we're supporting. And then it became very clear, this would be a policy that would advance the equitable system. So then we signed on to the letter to Chef Jose Andres saying, yes, please, you must change the hiring practices and the wage practices in your restaurants. If you're going to be a chef who's advocating for equitable food systems, this is important. So that's another example of where we use that tool, then not just to shape the work that we were doing, but supporting the work of other partners.
Great, thank you for those examples. And I think it really demonstrates how we have worked to put that resource to practice. And as Chloe mentioned, we are also continuing to look for feedback. So as all of you utilize that resource and see how it works within your organization, we welcome that feedback about how it's working and being implemented in your organizations. I have one last question that's come in around the hospital community benefit. Do you have any recommendations for how to build a relationship with a hospital in a community, or who interested people should be reaching out to within that hospital?
Yeah, great question. And for those of you who have the resource open right now, this is outlined on I believe it's on page 3. So there are specific folks within the nonprofit hospitals that are tasked with managing implementation of those community health needs assessments. So again, as I mentioned earlier, all the nonprofit hospitals that are participating, let me go to the tax-free benefits, are having to conduct community health needs assessments and then implement those. So what you can do is find out at the hospital there is someone, and this is required on the community health needs assessment that this person be listed. There is someone that's responsible for implementing that community health needs assessment. So what you can do is you can go, figure out which hospital or hospitals you're interested in reaching out to, go to their website and find out listed on their community health needs assessment who it is that's managing that process. And then you can start a relationship with that person, again, not directly going in and saying, hey, we're trying to find funding to support farm to school activities, but going in and saying, I saw the community health needs assessment. It includes a focus on, needing to improve food access, food insecurity, whatever it may be that is outlined in the assessment. And then you can use that as a, entry point and just talking about how farm to school is a proven strategy to address whatever it is they've outlined as needs. So that's, for those of you who are looking, it's at the bottom on the left-hand side of page 3 where it outlines how you find out who to contact.
Great. Thanks for sharing that, Helen, and walking us through that. Those are all the questions that we have in the question box right now. I'm sure that Helen and Chloe would be available for any additional follow-up questions as those come up for you. As a reminder, all attendees will be receiving an email with a link to this recording, as well as links to all of the resources that Helen and Chloe discussed today. Helen and Chloe, I'll turn it back over to you if you have any closing comments.
Great. Thank you, Lacey. And thanks to all of you for attending today. I don't think we have any more content to share, but just want to thank you all for your participation and interest in these new resources. They're great opportunities for you all to align with the mission, vision, and values of the National Farm to School Network, and collectively for all of us to grow the movement. So take some time, dig into them, and then, as Lacey said, please do follow up with us with questions. We're here to support you and really taking these resources and then using the strategies in them to advance the work that you all are doing around the country. Chloe, any last items from you? All right, hearing none, that'll do it for today. Thank you all. We look forward to seeing you on future webinars. Have a nice afternoon.